Well, you might kind of come in here. We can see some varicose veins really that are underneath the skin here. They're not really bulging right now. They're saying their prayers. They're on death row. They're going to die soon. No one survives. No ugly looking vein survives vein 911, I can tell you that. So anyway, what we're doing today is we're painting away a trunk vein, the lower half of her GSV, greater saphenous vein. Say that fast 3 times. Greater saphenous vein, greater saphenous vein, greater saphenous vein. Anyways, she has a residual trunk vein here that is leaking, because vein disease is 4th grade stuff, leak in the attic, flood in the basement, and we were literally going to paint this vein away with some magic foam. There are 2 types of foam. There is a proprietary foam that we typically would use for a trunk vein, but there's also what we call physician-generated foam that, honestly, foam can be used for any vein. Trunk vein, branch vein, varicose vein, spider vein. We use it for everything. The answer to everything in our office is, what, Alexa? Foam, right? Mm-hmm. It's always foam. So foam is just the most magic thing in vein care. So anyway, Joy, if you want to take a look at the ultrasound, I'm now in long, and you can see the black pipe there. So that's the great saphenous vein trunk. This is all, like I said, 4th grade stuff. You can even grade me at what I'm doing here. So you can see the trunk vein, and in a moment, in a minute or 2, it's going to turn into a white line. And the reason it's going to turn into a white line is when we inject the foam in there, there's little muscles in our veins, and it's going to contract the vein and look like a string. So the cool thing about foam is it actually looks like foam on an ultrasound, because most people don't know what they're looking at when they look at an ultrasound, but a 4th grader can understand this. So when I inject the foam, it's actually going to look like foam, because air creates little echoes that we see on an ultrasound. So we now have the trunk vein on a bead here. Very good. And I'm going to come around a little bit and pinch, pinch, pinch. If Alexa hurts you, let me know. She's helping me. And so you're going to see the needle literally knocking on the door there. And we are in the vein, and now I'm going to inject the foam in the vein. And you can see that that black pipe is turned into a white line. 4th grade stuff. So I'm going to follow this trunk vein, and you can see the foam going into the vein, and that's how easy it is, ladies and gentlemen, to treat varicose veins, swelling, restless legs, night cramps, ulcers, itching. All those things are caused by vein disease, heaviness. 25 years ago or 20 years ago, they used to send you to surgery, but only if your leg was about to fall off, and they do the stripping surgery, long recovery, hurt a lot, and recurrence was high. Now we can do this as a drive-by, inject foam, get rid of it. In fact, we're thinking about doing a drive-through. I've been thinking about that for 5 years. I told them I was a crazy man. I mean, you just stick them out the window and drive by. Isn't that the world we live in? Snapchat, drive-through.